My name is Nicole Panek. Today's date is August 30th, 2025. Today I will be demonstrating how to perform a physical assessment on a patient. The first thing I would do is knock upon entry and introduce myself to the patient and wash my hands. I will also provide privacy and explain the procedure to the patient. I will then identify the patient and move the bed to a comfortable working height. Can you please state your full name and date of birth?
Diane, May 20th, 1963.
At this point, I am ready to begin the assessment. Do you have any pain today?
No.
Do you have any symptoms that you are concerned of today?
No.
Okay. Do you know what today's date is?
August 30th, 2025.
And do you know where you are?
Yes, the hospital.
Okay. This is an assessment to assess orientation. I've noted that her speech is clear, and she is alert and oriented to person, place, and time. I will then begin the rest of the assessment. I'm going to take her blood pressure. And we're taking a blood pressure on a bare arm so that we can hear properly. Good. Her blood pressure is 118/64. Go ahead and get a temperature as well. Good. And then going to assess her pupils if you just look straight ahead. And her pupils are reactive to light. Go ahead and open. I'm going to assess the oral mucosa to make sure that it's pink and moist. I am then going to assess her skin, check for temperature and her skin turgor. Everything looks good here. And go ahead and grab both of my hands. I'm going to assess her grasps and go ahead and squeeze. She has equal grasp bilaterally. I will then assess her chest. I'm going to have you sit on the edge of the bed for me. And I'm going to listen to her lungs and her heart. And we want to make sure that we're listening to the lungs and the heart with a both on bare skin so we can hear. Go ahead and take some deep breaths for me. Go on the side. Deep breath. This side. Nice deep breath. I'm going to go around to the back. Deep breath. Deep breath. And one more. Listen to your heart. And listen for 1 full minute. Noted that her heart rate is regular and her lungs are clear. And then you can go ahead and lay back down. I'm then going to move down to the abdomen. I'm going to listen to bowel sounds first. She has bowel sounds active in all four quadrants. I'm then going to palpate for any distension, any pain.
No.
Her abdomen is non-distended and non-tender. Do you have any issues with your bladder, moving urine at all?
No.
Any issues with your bowels or your bowel movements?
No.
Do you remember when your last bowel movement was?
This morning.
Okay. I'm then going to move down to the feet and the legs. Here I'm going to assess her color, temperature, if there's any peripheral edema. I'm going to assess her pulses. Check the pedal pulses. And then I will inspect the feet and the heels. Everything looks good there. That looks good. And then at the end of the assessment, I want to be sure to check for wounds, dressings, and any other abnormalities that may be present. I also want to assess any behaviors that could be occurring and be sure to document the assessment. Thank you.